How to know when dizziness is a serious symptom. Some people experience dizziness as feeling lightheaded or faint, getting the spins, losing balance, or having tunnel vision. Dizziness occurs for many reasons. Usually, it's nothing to worry about. Sometimes, however, getting dizzy can be a sign that something more serious is going on. If you get occasional dizziness without any other symptoms, don't worry. Learn to recognize signs that you should discuss your dizziness with your doctor, or seek medical help right away. Recognizing when you're having a health emergency. Call emergency services if you're dizzy and have chest pain. Chest pain by itself should be a red flag that something may be wrong with your heart, but take it even more seriously when it occurs with dizziness. Chest pain, shortness of breath, and dizziness or lightheadedness are some of the most common symptoms of a heart attack, caused when your heart isn't getting enough blood to your brain. If this occurs, call for help immediately. You might also experience an irregular heart rate, which may or may not cause chest pain. Get help if you're dizzy and your heart is beating out of sync. You might also experience an irregular heart rate, which may or may not cause chest pain. Get help if you're dizzy and your heart is beating out of sync. Get emergency help if dizziness is accompanied by weakness or slurred speech. It's normal to feel a little off balance or fatigued when you're dizzy, but if you experience a quick onset of weakness, especially on only one side of your body, this could signal that you're having a stroke. Pay attention to whether your speech is more difficult or if your face is drooping on one side. Call for help as quickly as possible if you experience any of these symptoms. Other symptoms of a stroke include your face, arms, or legs feeling numb and difficulty walking. Other symptoms of a stroke include your face, arms, or legs feeling numb and difficulty walking. Notice if your dizziness occurs with a severe headache. Even if you get minor headaches regularly, pay attention if you feel dizziness and have a new headache, a severely painful headache, or a headache that differs from what you usually experience. If this occurs, have someone drive you to the emergency department or call for emergency services. Call for emergency help if you pass out. Take a trip to the emergency department if you lose consciousness, or if you lose your immediate memory. Sometimes people pass out because they're dehydrated or anxious, but it can also indicate a serious problem that warrants immediate attention. Seek immediate care if you hit your head. If you become so dizzy that you fall, even if you do not lose consciousness, go to the hospital if you hit your head. Head injuries can be very serious, and symptoms of damage may not occur until later. You need to be tested for a concussion and, possibly, for bleeding inside or around your skull. Don't ignore a high fever or stiff neck. Meningitis can be a serious and potentially deadly cause of dizziness. It often occurs with a high fever of 102 degrees Fahrenheit, 39 degrees Celsius and up, and/or a stiff neck. Nausea, vomiting, confusion, a skin rash, or seizures may also occur. Get help right away to begin treating the infection. Go to the hospital if you are continuously vomiting. Vomiting and dizziness may go hand in hand. These may be symptoms of vertigo, Meniere's disease, meningitis, or other illnesses. Persistent vomiting can make you dehydrated quickly, which is both dangerous and will exacerbate your dizziness. Seek medical care if you're vomiting regularly for longer than a day.